Hi, thanks for tuning in to episode number 32 of the Doctor Podcast Show. I'm Dr. Robert Seiker, your host. In the last several years, especially since the beginning of the pandemic, I've noticed that a lot of medical literature I read in both in ophthalmology journals, because I am an ophthalmologist, as well as in other medical journals, seems sometimes suspicious to me in that the findings or the results seem to be a little bit out of the ordinary or not really fitting with previous common sense that we use as doctors. I sometimes suspected that there was something wrong, but there was no way to tell for sure. And there's also been a huge increase in the amount of medical literature in recent years with numerous journals, very difficult to keep up with. Recently, I saw some information online about Dr. Elisabeth Bik, who's our guest today. And Dr. Bik is a expert and a scientific integrity consultant. She is a Ph.D. in microbiology, but has become a detective or a sleuth about scientific literature and especially medical literature. So thanks very much for joining us today, Dr. Bik. We really appreciate this opportunity and you're taking the time to come and tell us about this. Now, I know you started out as a PhD in microbiology. When did you decide to become a detective or a sleuth about medical and scientific literature?
Around 2019, I quit my job. I had worked 15 years at Stanford, and during that time, I became interested in image forensics, duplicated images. But I was still doing that as a side project or a hobby. But in 2019, I just thought I just want to do this full time because I was looking forward every evening coming home from my regular work to start doing that. And I just thought I can make much more impact on science as a field if I do this full time and not have to worry about a daytime job. So I quit my job and started doing that 2019.
Wow, you quit your job. That's
Yeah.
amazing. So is there any incident or something that happened that caused you to quit your job and decide to become a scientific detective?
It was one evening I was talking to a collaborator, from my work. And I just realized when I talk about my work, I feel I have to put effort in to sound enthusiastic. And when I talk about my hobby, the science integrity sleuthing, I sound much more enthusiastic. And maybe I should just do this full time. I wish my company that I worked at, all the best. But I just felt I just need to stop doing this and switch over to scientific integrity.
Right. Now you have a website dedicated to that. What's that website address?
It's scienceintegritydigest.com. It's a WordPress blog, and I don't really blog a lot. I should be doing that more. I still like to hang out on Twitter a lot. But I try to write roughly once every month or so. But people tell me I should write a little bit more often, so I'll try to do that.
Right. Now, you recently broke two amazing stories. I consider them amazing, and they've been written about all over the internet. As you know, there have been some plagiarism issues going on at Harvard in general, but this is specifically medical literature. There was some incidents with a neurosurgeon researcher and also some issues with the Dana-Farber Cancer Institute, which is one of the top cancer research facilities in the world. Can you tell us about these two incidents, what you found and what happened?
Well, in both instances, I'm not quite sure what the first one you were alluding to was, but I've been involved in tons of cases. Usually
Right, I
people
think
ask,
it's Dr. Shad at
oh,
Harvard.
yeah. Oh,
Yeah.
That one I was involved in. Yes, that was one I found myself because I got a tip from somebody who was familiar with that lab, saying there's a lot of cutting corners in that lab. It was not a specific request to look at a particular paper, but just a general feeling of unease on how laboratory data was handled in that lab. So I just decided to take a look. and found several papers with image problems. But there was one specific paper that stood out because in that paper, a lot of figure panels, a lot of photos from tissues were not unique, but the software I was using said that they came from older papers. And these were not papers from the same research group, they were from a different research group. So it appears that images had been copied from other papers and passed off as their own. So a Harvard lab, you just would not expect that. The other,
That's a major problem because in the past,
yeah.
myself and other physicians, basically, we look at peer-reviewed literature as sort of gospel. We make
Mhm.
clinical decisions based on that. So this is a major problem. What
Yeah.
I've heard you use something called image twin software. Can you tell
Mhm.
us about that, how that works?
Yeah, so it's basically a website where I go to and then I can drag and drop a PDF, a research paper into their search window, and it will then look at sort of analyze what are the photos in that paper and compare each of these photos to a database of other photos that have been previously published. So that is how this software found hits with other papers. Now it only looks, I believe, at open access journals because those images are free to use
Right.
for, for other purposes. And so it might not find all hits with all papers, but if it's an open access paper, it will find a hit with that. And it will also look at duplications within a paper. So it also found a couple of those.
Right. So what's happened since then, since you brought this to the public's attention?
Not much,
How
actually,
much?
as usual. I mean, I report these things to the journal and to the institution, and usually, as you know, most of these cases, I get a nice email back. Thank you. We'll look into this.
Uh,
But that's sort of the status, I guess. The
have
Wall
they
Street
looked
Journal
into
wrote
it?
about it. What's that?
Right. Have they looked into it or replied to you?
So they reply with the standard. We will look into it, but usually you won't hear anything after that for about a year or so. These investigations, of course, they do take time. There's usually an
Right.
institution will first do an inquiry phase and then an investigation phase, and that by together that will take usually 2 years or so. So that's a very long time. So I
Yeah.
don't expect anything to happen anytime soon.
Have you mentioned that you hear from institutions, you also hear from the medical journals where these articles were published. And how about the authors? You ever hear from the authors?
Usually not. So in most cases, I will also post these on a website called PubPeer because I don't really want to do a private conversation with authors. That usually doesn't lead to a lot of useful exchanges that usually, people are angry and people are frustrated and people might accuse me of all kinds of things. So I rather keep these conversations in the public. So I post them on the website. I make sure that the authors are tagged so their email addresses are there and I look up what their current affiliations are. But very often, in almost all cases, they do not reply. And I think in this case also the Harvard doctor did not reply.
I see. Are you concerned about retaliation or threats or lawsuits, things like that?
I am, and with good reasons.
Right.
I've never been sued, but I've been threatened with several lawsuits. So usually you get an official legal letter from an attorney or so asking me to take down a blog post or just occasionally an author will reply with something. But there are several authors who have really sued other whistleblowers, other people who have criticized their paper. So there's a Harvard professor who is currently suing three science critics, calling themselves data colada, and she's suing them. So that is a very possible threat, and I'm worried about that. I'm just a single person. I
Right.
don't have a whole institution behind me. But
Right.
yeah, I feel I should be able to criticize or at least raise concerns about papers.
Right. Once you've gone public, I assume you've investigated this thoroughly and are
Mhm.
100% convinced that what you found is correct, but still you're possibly subject to lawsuits or
Mhm.
defamation claims and things like that. How do you support and finance your work since you're not employed by any institutions?
Yeah, that's through crowd funding. So I have a Patreon account where people can donate money, and so donors come and go. They might support my work for a year or so and then move on to another cause. But most of my supporters are, I believe, postdocs who can, maybe afford $1 or $5 a month. So they're usually small amounts, but together that provides me with a basic income. I also give talks at universities, and I ask for a honorarium because just giving a talk, and if they reimburse my flight, that's nice. But, if you travel, you
Right.
make more costs, and I just need to have some basic income. So I ask for a honorarium to give talks, but I still give a lot of talks for free. If it's a student run or a postdoc run seminar series, I'll do those for free.
Right. And what about the Dana-Farber Cancer Institute? What happened there specifically?
That was not a case I was involved in at first, but this was mainly findings by anonymous commenters on PubPeer, and Sholto David, who is like me, has a background in sort of molecular biology, and is now doing this. I think he quit his job. He did his PhD and now is doing this pretty much full time. And he found a bunch of problems in papers from, I think, 4 different researchers in Dana-Farber. And I was asked by several journalists to go over these allegations and help them understand what they meant, because sometimes it's, we mark these things with colored boxes, and how serious are they? So I've helped several journalists looking over these allegations and give them an idea of could this be an honest error? Could this be intentionally done? Things like that. So I was more asked for a second opinion, if you will, than that I was directly involved in this case.
I see. Now you mentioned PubPeer as a place where people can go to look this up. Can they post articles that they think might not be 100% accurate?
Yeah, anybody, I believe, can create an account. It's a little bit easier to set up an account if you have an EDU type of email address, but
Right.
you can always contact the persons who are running the site, and they will help you set up an account. But if you're new to posting there, you cannot just post whatever you like, because it would, turn into a very nasty website if you would allow everybody to just say what they like. So
Right.
it needs to be moderated. So I'm out of moderation. I've posted enough to know that I post, my concerns in a serious way, but it cannot be an accusation of fraud. So you can say, oh, this image looks unexpectedly similar to that image,
Right.
but you cannot say, Dr. X is a fraud, and here's another example of that.
Sure.
That is not allowed. So there's moderation, there's rules on how you can post things. But yeah, in principle, anybody can post either under their full name or anonymously, which you can think of examples where an anonymous account would work a little bit better.
Right. There's also a site called Retraction Watch that I've heard
Mhm.
about. Is that a
Yes.
similar to PubPeer?
No, it's Retraction Watch specifically looks at papers that have been retracted or sometimes corrected. So that is sort of covering examples where maybe perhaps first concerns were raised on papier. The concerns were raised, then the institution or the journal looked into it and perhaps corrected or retracted the paper, and then Retraction Watch will post about that. They have a database of retracted papers, which you can, if you write scientific papers, you can, it works together with several of the citation manager that people might use to make sure that all their citations are in the right order and, in the right format. So several of these citation managers work together with the Retraction Watch database. So you can see if you cite a paper, if that had been retracted or not, and perhaps choose another paper to support your wordings.
Right. And years ago, there weren't too many retractions of these peer-reviewed journal articles, but there seems to be more and more of them over time.
Yes.
And how many articles have you found that are suspicious or have been retracted or changed or edited?
I found around almost 8,000 papers. I think
8,000.
7,800 with problems. Yes, varying from plagiarism, image duplication, image reuse, image manipulation, but also sometimes concerns about ethics, where there was no ethical approval number, and you just don't know. So it can be all kinds of problems that I could raise. And about 1,000 of these have been retracted, and another 1,000 have been corrected. I have not I've not posted all of these to the journals. I've posted most of these on papier, but I'm very much behind in reporting these to the journals and institutions, mainly because they don't seem to respond a lot. So I just want to warn other people there's a problem with this paper, and I post it on papier.
Right. So you're saying about 25% have been either retracted or changed as a result of your detective work, right?
Mm-hmm. Yeah, but I haven't, I think a lot of journals might not even know that I found a problem because I still haven't reported it to them. So I need to take 2 weeks off and just send out all these reports to the journals.
Right. Now, I've read about something called research paper mills, which are
Mm-hmm.
responsible for this. Can you tell us some information about what that is and what they do?
Yeah, research paper mills are networks of scammers, I guess, bad people, people who want to make money out of the whole scientific publishing business. And there's different types of scams. So there's no one paper mill. There's probably many of these networks. But so they use different strategies. One might be that they plagiarize a paper, but they know that these papers are perhaps screened for plagiarism. So what they do, they have a synonymizer, some software that will change all the wording into something else. So you get these funny papers that instead of breast cancer, they might use bosom peril. And you're like, what is bosom peril? And then you're like, oh, it's breast cancer. And if you translate it back, you can sometimes find the article that they plagiarized. Other paper mills they work with a template. And so they write basically the same paper over and over, and they use real images from perhaps a microscope. So maybe they are associated with a lab, but they just pretend that these cells in one paper, the same photo might be prostate cancer, and in another paper that might be breast cancer cells. And you wouldn't be able to tell because the papers look realistic. The data looks realistic, but I think it's all made up. And sometimes we can find these duplicate images across papers, and you can just see that these probably had the same source. Maybe these authors were buying their papers from different sources. So the papers are being sold to authors who then are put on the paper, even though they haven't contributed. And so their names will be on the paper, but they just bought an authorship. So this is how they make money.
That's outright fraud, right?
It is, because these papers are usually fake or plagiarized, or so they're fabricated, or
It's also
yeah,
dangerous
plagiarism.
because
It
if
could be.
other papers or research is based on those fraudulent research papers, it can lead to wrong conclusions and endanger people's lives.
For sure. I mean, these end up in meta-analyses, and they could be used to create a false narrative of some kind. And in most of these cases, these are not earth-shattering research type of papers. They're very basic research. But yeah, it will generate a lot of wasted time and effort. Other researchers might try to replicate these papers, and you can assume that if it's made up, that probably another lab cannot replicate those results. So it leads to a lot of wasted time, and it just pollutes the whole scientific literature, and makes certain fields seem to be completely infiltrated by these paper mills. And it's currently estimated that about 2% of all scientific papers are completely fake, are generated by these paper mills. And 2% might not seem like a lot, but
That is a lot.
in absolute numbers, it's staggering.
It's huge because there are
Yes.
thousands of new articles published
Yes.
every week. Like I said,
Yes.
it's possible for me to keep up with all the literature just in
Hmm.
my field. So
Yeah.
that's a huge number. Who runs these research paper mills and where are they based out of?
So I actually don't know. I mean, people find advertisements. So other people, there's many of us detectives. So other people are focusing on these advertisements that you can just see on on Papier, sorry, on Facebook, on social media. They advertise, and sometimes you see them on even on Twitter, where people say, "Oh, we offer academic writing," but basically they're running this paper mill, and it's very easy to find the advertisements. I believe they run, some run in China, some run in Egypt, Pakistan, Russia. They mainly run in, I would say, countries where there are very strict requirements for what a PhD student or a medical student needs to publish. And especially for medical students in China, there's a very hard rule. If you finish medical school, you have to publish a scientific paper. And, some doctors are interested in research, but not all are. And so to require them to write a scientific paper seems, that doesn't make them a better doctor, right? So these folks usually don't even have time to do research, so they might just buy a paper. So we're not quite sure who's running them. Social media doesn't seem to. I've reported several of them, like this is illegal activity, but I don't think the social media sites really seem to care about it.
That's pretty amazing. And what does it cost an author to purchase a research paper that's fraudulent, that they did not participate in at all? Do you know?
Well, it depends. Do you want to be a first author or a second? So the price is the
Or do you
highest for
want to
the
get a
first.
Nobel Prize?
Well, that luckily, hopefully, is not as
Right.
corrupt yet. But no, I think it varies from. I've seen $500 and I've seen $5,000. So it probably depends on who's running it, and with maybe so many paper mills active, maybe the price is going down. So, but
Competition.
the worrisome thing is that in some cases there's evidence that these paper mills work together with guest editors of journals. So the guest editors presumably get some kickback, get some money from the paper mills to publish
Really?
these papers. Yeah. And journals might actually be enjoying it, especially if they run a paper, a journal under the open access model, because an open access journal will make more money if they publish more. And so it's misusing the whatever. It's a very good model, the open access model. It's good to have science open, in my opinion, but several journals have seen these open access journals as a way to make a lot of money. And so there have been some publishers that have these open access journals that have suddenly started to publish enormous amounts of papers of very, very low quality. And many of them are suspected to be by paper mills. And Hindawi, for example, has recently been acquired by Wiley. And Wiley has realized that Hindawi was publishing mainly paper mill suspected papers, or at least very poorly reviewed papers. And they're massively retracting whatever Hindawi has published in these special issues. And I think last year they retracted 10,000 papers. So a
10,000
massive
papers.
amount. 10,000 papers were massively retracted last year because it was realized that these papers were all not peer reviewed. They were, maybe the guest editors was either looking the other way or actively promoting them and being paid by the paper mills to publish these papers.
Sounds
I
like
know.
an
it's
incredible
incredible.
racket. Right. Now, I've noticed just during the pandemic, there are just huge numbers of articles written about COVID-19 from all over the world. It's
Yes.
impossible to keep track of it. Is there a lot of that going on in COVID research and articles?
I'm not quite sure about if the percentage of fake papers is worse or better than in other fields, but I know there's a lot of editorials and fake reviews published that are not going to contribute anything to science because they just regurgitate what other people have said, and in that time a lot of things were published that should have not gone through peer review, and I think it's probably higher, I would guess, because I'm assuming that a lot of people wanted to have a breakthrough discovery in light of COVID, where a
Right.
disease where there was in the beginning. It's easy to forget how panicked we all were, and how full the hospitals were, and how many people passed away, and it was just a horrible situation where I think a lot of scientists were like, oh, I'm going to save the world and publish something about COVID. But I think a lot of crap papers were published in that time.
Right.
And Retraction Watch keeps track of the percentage, so you might have to ask them maybe in the next podcast. But they keep track of how many retractions are there that are related to COVID. But it's probably higher than other topics because so many crap papers were published, and the peer review was very light during that time.
Right. Are there some specific journals that do more of this than others that publish this fake articles?
Yeah, there are specific journals that seem to be very vulnerable, and it's perhaps similar to a typical credit card scam where, first they try to withdraw $1, and if that works, then they'll start to withdraw larger amounts. So in this case, a journal might be targeted by a paper mill, and if they don't really see that it's a fake paper, then a paper mill might specifically start to target that journal. So we've seen journals that are completely infected by one specific paper mill, let's say a paper mill from China, where suddenly all their papers are very similar. They all come from different hospitals in China, but they have a very similar feel to them. And you just see that these, couple of hundred papers are they all were written on the same template. And you have to ask yourself, a peer reviewer might not see that because they only review one or two papers.
Right.
But an editor should be suspicious that suddenly, the manuscripts that are sent their way are suddenly all from one particular country and all from one particular topic. That has to raise some suspicion. But I think a lot of editors have been either, like I said, actively collaborating with the paper mills, perhaps sort of suspecting that there was something, but looking the other way, or completely ignorant and naive. So I'm not quite sure what option it will be, but it was. But yeah, there are specific journals that are completely infected by these paper mill articles.
Right. Can you name any of them or
Not as specific. There was a European review, but I'm very, very bad at remembering these names. There was one particular journal that I found. There was a set of 125 papers that all were using the same photos, and they were all published in a journal that started with European Review of Biomedical something, but I forgot the actual name. Sorry.
right? And this software, the image twin software, is that available to the general public, or is that something you have that's proprietary?
It's a software that is available for money. So I think they charge for the amount of images or papers that you scan. I have a free account, and they give free account to people who are sleuths like me, detectives who so
Right.
they give free account, but their business model is that they're selling their product to journals, to editors, to publishers, but perhaps also to institutions, because I think more and more institutions are realizing, we might have to screen what comes out of our institution and make
Right.
sure that people are not making mistakes and or are not cheating, and so institutions I think might also be interested in buying it.
How's that different from the Google image search where you can upload an image and then ask Google to
Mhm.
find other images on the internet that look like it or are similar to it? How's it different?
It's different in that it looks at individual panels. So if you do a Google image search, it looks at the whole figure. So it sometimes I might find an image actually in a scientific paper, but I think the Google images in their database is not specifically focused on scientific papers. They might not have even screened those because many of them are behind paywalls or are just not not on the type of web scans that Google does. But I think most importantly, it sees it as a whole figure with multiple panels. So if you have one particular panel, it doesn't find this as a hit because it's missing all these other parts of the panel. So a figure in a scientific paper typically has multiple panels.
Right.
Some of them are photos, some of them are bar graphs or other types of panels. So image twin is different that it specifically scans these individual panels and compares them to individual other panels in their database. But I've had luck with the set of papers from Harvard that we talked about before, where I found that one particular image in their paper matched a photo on the Fisher scientific website selling a monoclonal or some antibody against something. So there occasionally I will find a hit with Google search. An image twin did not find that because it was not in a scientific paper.
Right.
And I found several other examples then later by reverse image search as well. But it's very rarely that I would find a hit with a scientific paper in that way.
Why does it take a year or two for the institutions and the journals to investigate this? If you can demonstrate that the image in a scientific paper comes from a Fisher scientific site where they're trying to sell a product, isn't that automatic evidence that that paper should be retracted and the person who wrote it should be somehow held responsible for that?
Well, I think it takes such a long time because they not only look at evidence, but they also want to know who did it. And I think in a case like this, everybody will point fingers at each other, and everybody will probably deny it or will claim it was an accident. And it's just hard. And sometimes it might even involve going into databases of emails sent, like who sent what figure type first to their professor, or did the professor change it, or did the grad student actually send it in first? So those
Right.
things take a long time. Yeah,
Yeah, many of the papers have multiple authors now. So
definitely. Yes.
right, so that makes it more difficult because each of the authors contributed to some degree, so it's
Right.
hard to
Right.
track it back to the source. I've noticed in recent years there have been retractions from some of the major journals in the world, like the New England Journal and Lancet and Nature, which in the past I hadn't seen. Is that occurring more often?
I think in general, retractions are occurring more often, and so some of them also affect high impact journals. Yeah, I mean, there has been fraud found in all of these journals. I did a investigation of 20,000 papers and found that about 800 of them, 4%, contained duplications. And there was a lower percentage in high impact journals. So the higher the impact, the lower the chance that they had errors. But there were, I also found examples in Science and Nature. And so it happens everywhere. But yeah, I think with digital photography, it's just easier to cheat. And I
Right.
still had to bring during my PhD, I had to bring my wet gels and blots to the photographer in the basement. But yeah, I think now with digital photography, it's just easier if you want to cheat, to just copy paste and bring some lanes together, or perhaps if you have something you don't want to show, to cover that with other parts of the digital image. So that's on the rise, but I think, yeah, it happens everywhere. I don't think the high impact journals are immune to it.
You can basically Photoshop your way to a major article in a
Yes.
major journal. That's kind of frightening. So how are doctors like me in practice who are reading these articles, and again, I sometimes look at them a little suspiciously, how can we figure out if something is legitimate and real or something is fake? Are there any tricks you can tell us about?
Well, I look at images, and other people might look at statistical, errors or inconsistencies. But there's probably a lot of types of fraud that none of us would be able to detect. If you are really a good fraudster, you can make the data set look convincing enough that everybody will think it's real. I mean, if you make your error bars large enough, then your data set variable enough, and you make sure that your data doesn't all end with the same digit, that the last digit is not repetitive,
Right.
things like that. There's many ways of doing fraud. Not that I want to give anybody any ideas, but a good fraudster would be totally able to get away with it. And so what we're finding is really only the tip of the iceberg. I try to raise these concerns. So I sort of play a game on Twitter where I say image forensics. That's the hashtag. And so I post an image with a duplication, and people have to find it. So I try to raise awareness of this is happening, because I think once you know that it's a possibility, you might actually find a duplication yourself. But I also try to make people more aware, like institutions and publishers, that they screen for these things. But yeah, they're not always easy to find. And I've definitely missed examples. There were papers retracted. The Surgery Sphere paper retracted from, or two papers retracted from the Lancet and New England Journal of Medicine. Those, I actually retweeted one of those papers because I had no idea that that data was fake, but that, that came out at some point. But the best thing I can do is to recommend to have a Papier plugin installed. So it's a plugin or an extension that works with your browser. And you will see if a paper has a comment on Papier. You will see a green banner, and then you can click on it and you can see if people had concerns about the paper, or you can raise your own concerns. But I think that's the best way to do, because now with the internet and with these websites, at least we have the possibilities of collectively raising concerns. Previously, you could just only write a letter to the editor. There was just not many other ways, but now we can make these concerns public. So that is what I would recommend, like install the Papier plugin in your browser. And so if you do a literature search, you might see a green banner appear if a paper has a concern.
Well, that's good to know. So at least you can flag it. There are more and more articles in the medical literature where they do meta-analysis of previous articles and then come to conclusions that are supposedly statistically sound because they're compiling results from numerous articles on hundreds of thousands or millions of patients. My concern is that some of this meta-analysis may be derived from fake studies. How does that basically create more of a problem for us?
It does, because again, these fake papers are polluting the literature. So if you do a meta-analysis and you include a couple of these papers that later turn out to be fake, then your analysis is skewed in a certain way. So again, I think the Papier plugin will perhaps tell you if you look at those papers, people might raise concerns about these meta-analysis and saying, half of the papers are retracted now. So, you probably should not believe this meta-analysis anymore. But it is, it's a big problem. And I'm focusing again on images. Other people focus also on meta-analyses and try to flag the ones that they believe are not reliable. And again, they will post those on Papier.
Right. Sounds like the detective work is becoming a huge business in itself, just from the volume of papers that are out there.
Well, and most of us are volunteers. Like we just do this because we believe this should have been caught during peer review. But peer reviewers might be maybe very naive, or they miss particular things, and so it's frustrating that journals seem to not really do a lot of quality control. And I hope they will hire specialists who will scan these papers after perhaps they have been accepted. Just scan them for the known problems, the statistical things, the images, and do a better job. They should be doing a little bit better quality control.
Right. Have you come across any instances where papers associated with FDA clinical trials have been retracted or found to be fake?
Several of these. I've worked together with projects that involved drugs that were still in clinical trials, so not FDA approved.
Right.
But in one case, the FDA has halted the clinical trial. So that is, I think, a very prompt reply from the FDA. In another case, the FDA was alerted, but did not actually said that they felt that they weren't the right agency to have been contacted, and the trials are still ongoing. But we have suspicions that a lot of the preclinical data wasn't done well. So it seems to be very variable. In one case, they responded really fast. In another case, they didn't seem to care.
That's very concerning because you're talking about clinical trials of drugs or medical devices that later be found to cause a big problem. There are some websites now that compile pre-printed articles before they're published in the medical journals. I notice these sites have just a huge volume of literature going up every day, impossible to keep track of. Is there a lot of fake articles in those sites as well?
Funny enough, there seems to be almost no fraud there, and I think this is
Really?
because the goal of the paper mills is to get these papers peer reviewed and published, because then they will count for the authors who buy these papers. But a preprint doesn't fulfill that requirement. So, and they also know when it's in a preprint, it's not just 2 or 3 peer reviewers looking at the paper and approving it. It's suddenly in the open and there's maybe thousands of eyes on it. So I think the real fraudsters will not choose to preprint their paper, because they just know, if there's a fraud, it's going to be discovered, and we haven't then, made it past the peer review stage. So I found a couple of errors in those papers. Sometimes people alert me, and that seems to be always an honest error where, they have like a bunch of panels and they grab the wrong panel twice. And the author immediately replies in those cases like, oops, yes, we made an error. You're absolutely right.
Fix it.
Here's the new figure. This is how it should be. And you can just see that it just feels legit. Like they really apologize for the error and quickly correct it. But yeah, those, I think sunshine is the best disinfectant, right? Like these papers are out in the preprints are out in the open. There's many eyes on them. So a real fraudster is not going to choose that path.
It's very interesting that
Mm.
those seem to be even more reliable. So in this
Mm.
era of software and AI, it seems to me like medical journals and institutions should be able to search through the literature and articles more easily and find the fraud before they publish it, no?
That's what you would think. And
Right,
partially the software we're using, so I'm using Image Twin, but there's also one of their competitors is Proofik. Both of these are partially AI based to find these duplicates. But the main worry is that AI can generate images that are
right,
very believable, and
right. AI hallucinates, right,
he hallucinates it, but it creates photos of faces. The New York Times had, I think 2 weeks ago, they had a, spot the AI generated face, and you had to choose, is this face AI generated or not? Is it real? I did miserably bad in that, because for me, these faces looked completely believable. And so if you can make a photo of a face, it's much easier to make a photo of a bunch of cells. So so I think this is already happening. And AI, it creates fake references, but it also creates completely fake data. And that data is unique. Those photos you cannot search with a duplication detector. They're uniquely generated. So we need even better AI tools to catch the AI generated
right.
photos.
I
So
have to check that out. I go
Mhm.
to Midjourney website on Discord, which creates AI images that are incredible. I wonder if I ask it to create some medical images, if it'll do that or not. That's something
Probably, yeah, but don't give the
to
fraudsters any ideas. Yeah.
no. I'm
No.
sure they
Yeah.
thought of it
Yeah. I'm
well
sure it's
before.
happening already. Yeah.
Right. Now you mentioned a few times that you're getting tips from the public. How many tips a day or a week are you getting?
I would say one or twice, two a day, so one or two. But some tips are just, this paper looks fake. And I'm looking at it like, yeah, I mean, there's no smoking gun. Maybe it's fake. I don't really know what to do with it. And then others are more like the one I got from the Harvard lab. Like, I suspect this lab is doing fishy things. I'm looking into it and I'm finding one after another with problems. And those, one tip a day, but if some of these tips can lead to weeks of work. So I always get way more tips than I can handle.
Right. So you need to look at the tips with specific items rather than just, oh, check it out, it looks fake, right?
Well, that could be a real tip, but some of these are, I think, driven by perhaps competitors or people who want to take down other people.
Right.
And if I don't find anything in it, then, if a person sends me 3 tips in a row that are completely useless, I'll just say, maybe you should just switch to something else. I don't think you're cut out for this work. But
You blocked
uh,
that email.
yeah, I know I've blocked several, because that turns into a very long discussion, and I don't really want to. I want to move on to and help the next person. Yeah.
Right. Not enough time in a day. Well, this has
Definitely.
been extremely informative and educational. And from now on, whenever I read a paper that looks kind of funny, I'm going to get an email message from me.
Okay, well, from all your listeners, perhaps too. Well, I already get enough, but yeah, we'll see. I do my best. There's just only so many hours in a day, right? But
Right.
yeah.
What's your X or formerly Twitter handle?
It's microbiome digest. So I used to work on the microbiome, the human microbiome, and I had a daily digest of papers. But microbiome digest, which is also the website I was running, I had to drop one letter because Twitter only had so many letters for the handle. So it's microbiome digest without the E somewhere in the middle. Yeah. But Elisabeth Bik will also, there's only one me, so I don't think there's
Oh,
another Elisabeth Bik.
there's no fake Elisabeth Bik
I'm
yet.
sure there's some fake accounts, but the one with 145,000 followers, that would be me. Yes.
That's pretty awesome. Well, again, this has been extremely informative, educational, and I think the audience will really appreciate it, and I certainly do. And I want to congratulate you on the work you've done, and please continue doing this. It's very important, not just for the medical and scientific community,
Mhm.
but it protects the public as well.
Yeah, I've done my best. Thank you for having me in this interview, Dr. Sakir. It's been my pleasure to be here.
Thank you very much. Have a great day.
You too. Bye bye.
Bye bye.